Buoy Health Insights, Coughing Up Blood. Hello, and welcome to another episode of Buoy Health Insights, where we delve into important health topics and share key insights to keep you informed and healthy. Today, we're going to talk about a serious symptom, coughing up blood, also known as hemoptysis. So, if you or someone you know has experienced this, keep watching for essential information. First off, what does it mean when you cough up blood? Well, it's a sign that there's serious irritation or damage to the blood vessels or linings in your lungs or stomach. This might be due to a severe case of bronchitis, various infections, serious diseases like tuberculosis or bronchiectasis, and it can even point to cancer. If you find yourself coughing up blood, it's crucial to seek medical attention, especially if other more serious symptoms accompany it, such as trouble breathing, feeling dizzy, or coughing up a large volume of blood. Now let's dive into some potential causes in more detail, as understanding these can give you a better sense of why this might be happening. One possible cause is a condition called bronchiectasis. This is where your airways are permanently widened, and you have difficulty clearing out mucus, which often leads to bacterial infections. This can cause blood to appear in your cough as streaks or small amounts. Alternatively, acute bronchitis might be the culprit. It's an infection and inflammation of the airways typically caused by viruses like the flu. Although other causes may not require specific treatment and might resolve on their own, you could cough up blood for several weeks. Tuberculosis, or TB, is a bacterial infection that can affect your lungs and even other organs. It's particularly an issue for people with a weakened immune system or those at high risk for the disease, such as those in close contact with TB patients or those visiting areas where TB is common. Cancer is another grave reason someone might cough up blood, especially if the cancer involves the respiratory system, such as lung cancer or cancers from other organs that have spread to the lungs or airways. Lastly, a pulmonary embolism can lead to coughing up blood. A pulmonary embolism occurs when a blood clot travels from the body, typically the legs, and lodges within the blood vessels of the lungs. Individuals who are prone to clotting due to underlying medical conditions, or those who have recently undergone surgery or are immobilized due to injury or other conditions are at increased risk. Now, let's also touch on what other symptoms might indicate these causes. For bronchiectasis, you might also have a chronic cough, produce a lot of phlegm, experience shortness of breath, and face frequent pneumonia. With acute bronchitis, you could experience several weeks of persistent coughing, but no other symptoms. For those with TB, apart from coughing up blood, signs include fever, night sweats, unintentional weight loss, fatigue, persistent cough, and chest pain. Cancer may present with similar symptoms to TB, including fever, night sweats, worsening fatigue, cough, shortness of breath, and chest pain. With a pulmonary embolism, additional symptoms include chest pain, shortness of breath, and pain when breathing. However, pulmonary embolisms may be difficult to detect, so a high index of suspicion is needed, particularly in those at increased risk. It's worth noting that other possible causes could include heart failure, use of blood thinners, pneumonia, fungal infections within the lungs, lung abscess, specific rheumatologic conditions, endometriosis, vascular malformations, some prescription and illicit drugs, or a foreign body in the lungs or airways. Lastly, and very importantly, some cases of coughing up blood are actually from sinus or nasal sources. A bloody nose can drain down the back of the throat, leading to blood in the sputum. When should you seek medical care? The answer is, as soon as you notice coughing up blood. It's crucial to tell your doctor about the onset, amount of blood, and any other symptoms accompanying it. Early diagnosis and intervention can be life-saving. Lastly, don't forget to subscribe to the channel for more health insights and like this video if you found it helpful. Always remember that your health is important, and understanding symptoms like coughing up blood can ensure you get the care you need promptly. Stay informed, stay healthy, and we'll see you in the next video.